I'm really excited about the conversation today. We have some great panelists who are very knowledgeable that are going to share some great insights to the nurse residency program here at Mayo Clinic across the enterprise. Um, Individuals who've been working at Mayo Clinic collectively for a long time and will be able to be great resources as you're looking to navigate kind of next steps in your career. Do I need a nurse residency program? Does that entail? How long is it, right? What is expected of me as an individual? So they're really going to cover all about the nurse residency program here at Mayo Clinic. And of course, do know we'll give you plenty of time for questions at the end. The panelists will hang on and they'll answer some of your questions. We will keep to the 1 hour time frame here just to be mindful of everyone's time, but certainly we'll have opportunity for questions at the end. So feel free throughout the conversation if you think of something and you want to ask it, put it in the Q&A session or the chat feature, and we'll try to get to that question at the end. Do know also that this webinar will be recorded. And so if you can't attend it fully today or have missed it, you'll get this recording sent to your email if you've registered for the 4-part series. I know many of you who have attended other parts of the webinar know my face, but for those who are new here today, my name is Heidi Bjork. I'm a nursing placement coordinator supporting hiring for the Department of Nursing. I'm specific here in Rochester, Minnesota. Rochester Mayo Clinic is my primary location. And I am excited to welcome our panelists. And we're going to jump in and get started right away. I'm going to go ahead and start sharing my screen, and I'm going to turn it over to Catherine to introduce herself.
Thank you, Heidi. Hello, everybody. My name is Catherine Gruen, and I am a nursing education specialist at Mayo Clinic. I'm based also in Rochester, Minnesota, and I serve as our nurse residency program director for our Rochester Mayo Clinic Health Systems and Florida program. You can see also Kim and Jennifer, who are nursing education specialists in our Mayo Clinic Health System in Minnesota and Wisconsin. They are also part of our nurse residency team and help support our health system sites. They couldn't be with us today, but please know that they wish they would have been able to be here. And if there are healthcare system specific questions, I can certainly answer them as well as our other panel members. So if you were interested in those sites, please know that we absolutely can answer your questions. Cindy, do you want to go next?
Sure. Thank you, Catherine. My name is Cindy Crockett. I'm a nursing education specialist and program director for residency program in Phoenix and Scottsdale, Arizona. Been with Mayo Clinic, it'll be 27 years, and have done residency for a very, very long time here. So really excited to share a little bit about our program here in Arizona. With that, I'll turn it over to Catherine in Florida.
Thank you, Cindy. Hello, everyone. Welcome. My name is Catherine Whitson. I am a nursing education specialist here in Jacksonville, Florida. And I've been with Mayo Clinic about 10 years and looking forward to chatting with you all.
And Anna, do you want to say hi? I know you're not on our screen, but Anna is also a very vital member of our team, but her picture is missing. So we'll have her say hello.
Yes, I am new with the nurse residency program here in Jacksonville, Florida. I've been in this position about a month with a residency program. But prior to that, I've been with Mayo Clinic for 3 years and worked with our ICU population as a nursing education specialist, working with those ICU residents and also with the emergency department with those residents. So I'm happy to work with Kathy here in Florida.
Yeah. All right. So we have a few objectives for you all today. We want to explore our nurse residency program, the structure, purpose, and the outcomes so that you know going into your careers how we are going to support you. We also hope that you'll be able to recognize the value and impact of an accredited nurse residency program. And then by the end of the session, hopefully you'll have a clear understanding of why these programs are really essential and how they contribute to your professional development and your success as a new nurse. Mayo Clinic has 3 major campuses across the United States. So our primary campus in Rochester, Minnesota, that's where I am at. We also have campuses in Phoenix and Scottsdale, Arizona, where Cindy is at, and Jacksonville, Florida, where Kathy and Anna are at. Our Mayo Clinic health system is a network of community-based clinics, hospitals, and other healthcare facilities serving communities in Minnesota, Wisconsin, and Iowa. Mayo Clinic is recognized globally for developing top quality care and advancing medical research. These campuses really work collaboratively. We are in an enterprise. We work really closely together to ensure that patients have access to world-class care no matter where they are. This system allows us to share our expertise and resources across locations, which really is key, a key strength of ours at Mayo Clinic. We were founded in 1864, which was quite some time ago, but Mayo Clinic has really been a leader in healthcare for over 150 years. And part of what makes us so successful is our primary value of the needs of the patient come first. And that's really what we live by. We also have 8 core values that define our behaviors and expectations, and we refer to these as our rich ties. So you can see those on the screen: respect, integrity, compassion, healing, teamwork, innovation, excellence, and stewardship. And these aren't just words that we say, they really are what we live by daily and are reflected in our history, our present work, and our vision for the future. And just a couple quotes. I wish we could have pages and pages to show you because we're really proud of our program. But here are just 2 quotes from residents that have experienced our nurse residency program. The nurse residency program provided me with a solid foundation, equipping me not only with essential skills, but also with a supportive network of mentors and colleagues. And at the conclusion of the program, I was proud of my professional growth, ultimately increasing my confidence as a nurse.
Okay, so I'm going to pick it up from here. And again, we're thrilled that you're here because that tells us that you have some interest in seeking what is residency all about. So we're going to tell you a little bit about our journey, and through the American Nurses Credentialing Center, the Practice Transition Accreditation Program, which is a mouthful, we'll call it PTAP for short, from here on out, really does set the gold standard for accreditation in all things residency. So being that global benchmark for a residency program and being recognized by ANCC really helps to guide in that transition from student nurse to practicing, nurse and a new beginner. So we know this, it is the gold standard. There is absolute comprehensive support that PTAP does align and guides our programs in the various standards. And it really shows that our program has commitment to fully supporting the nurse resident in that first year of practice. It's a lot, onboarding, orientation, clinical competency, mentorship, all of this, the leadership engagement, all of the things that you travel in that first year. And then also showcases the lifelong learning commitment that the being PTAP long-term, future learning, never just stagnant in nursing. We're always growing, we're always learning. So that professional growth and development is key, and that seamless integration into our practice. So the Mayo Clinic Nurse Residency Program benefits. It does provide that structured transition of practice, again, bridging that gap, because as we know, we have a foundation we learned in school, but what is it really like now we're in that clinical setting, that real world practice? What does that look like? Helping to provide that professional growth, that structured mentorship and coaching, preceptor, different from a mentor, building that confidence and really helping with competency and obtaining those skills to safely care for our very complex patients. Also enhances our patient care. Everything we do is evidence-based. All of our policies are rooted in the evidence and really improving that safety that we all want as a nurse coming out, that we're safely caring for patients and we're providing excellent quality to them as well. And then that peer support. We know that the literature is full of evidence to say that you want a fellow person that's traveling this journey and learning from each other. It's been a little while since we've all been new nurses, so that peer support is really key, and also helping to reduce any burnout and turnover. So looking at our Mayo Clinic residency programs, all of them align with one set of objectives. So as Catherine mentioned earlier, we're an enterprise. So we all have common goals for a program, and they're listed here, really working on that transition from entry level. So Patricia Benner's novice to expert level, starting as a novice nurse and that professional growth and providing quality care. We want to help with the development of effective decision-making and those skills and what it takes to grow that clinical judgment and reasoning and have that produce great performance and outcomes. Develop strategies for incorporating, again, resident-based or research-based and other evidence into your practice. Develop clinical leadership skills at the point of patient care. So how are you caring there and building those leadership skills and learning what you are in the classroom and bringing that to the bedside. And then, as we know, learning doesn't stop when you get out of school or after you conclude residency. We really want to formulate that lifelong learning and commitment to professional nursing, because there's so much that you grow in your years thereafter. So, as I said earlier, the theoretical framework, which we base a lot of our goals and our curriculum off of, is Patricia Benner's novice to expert model. So there is also Dreyfus model. Skill acquisition parallels very closely to Patricia Benner's model. And what we know is novice nurses, we were all there once as we began our career. And that's really those first 6 months, really looking at what is the recipe card. You don't have a lot of experience other than as a student nurse. So how do I safely care for my patients? So that's really the goal, to keep them safe, and we want those instructions, kind of like a recipe. Advanced beginner is like that 6 months to a year, so we're starting to learn and recognize patterns where a selective rule that applies, like, oh, I've seen this before. This is why the provider ordered that medication for this diagnosis. So we're starting to see those recognized patterns. Competent is really being beginning of that personal and emotional investment of outcomes. Now, this is different than competency, but competent is that you have that emotional investment in what's best for that patient, and really that's that 2 to 3 year mark. Really, you've got vested interest, and you've done that steep learning curve we've gotten through. Proficient is a little further than that. That's that intuitive grasp, really in your gut, you know that you know, but you still have a few things that you're figuring out, not quite sure how am I going to respond to this, but you're intentionally engaging and improving that practice. So you're reflecting, it's deliberate practice, reflecting, learning, growing. And then we get to the expert level. Expert level, you just know that you know that you know. And when you put a novice with an expert, the novice says, how did you come to that conclusion? And it's just an opportunity for the expert to break down, because they just can go from A to Z very quickly. So intentional engagement, improving that practice. So breaking things down. And we know that we're never always an expert in everything, because of lifelong learning, we're constantly growing. So the expert will always look to grow themselves in that deliberate practice. And then what we look at is the core competencies within residency. We really look to the American Nurses Association standards of practice. And these are interwoven all throughout our orientation record, which you'll hear us talk about in just a little bit. But there is a roadmap, and it is evidence-based, and it is supported by ANA. So that kind of really does guide where we're going within our residency. So with that, I'm going to hand it back over to Catherine.
Thank you, Cindy, for really setting the stage of why nurse residency is so important in this first year. So we are going to break this down a little bit by our respective sites. So we'll look at our Rochester program. So you can see in the picture here, we have our 3 sites. We have St. Mary's campus there in the top left, Rochester Methodist campus in the bottom left, and then our Mayo and Gonda buildings there on the right. Our Mayo Clinic nurse residency program in Rochester has a strong history of excellence in supporting new nurses. Our program was first developed in 2012, so has been going for a while, and was really provided that structured support for new nurses entering practice. And in 2018, we achieved our first accreditation with distinction from the ANCC PTAP that Cindy referred to earlier. And this year, or I should say this year, now it's 2026. In 2025, we achieved our 3rd reaccreditation with distinction, really reaffirming our commitment to high standards and quality outcomes. We are a 3-site, 13 practice setting program, so you can see those on the screen. And this really just reflects our dedication to supporting nurse residents, ensuring that we're meeting those global standards, and that we prioritize our safe, competent, and confident care in your transition to practice. To just clarify, our Mayo Clinic Health Systems and Florida sites participate in nurse residency. Our Rochester kind of program, if you will, we share this curriculum. And so we have nursing education specialists and content experts at all of our sites that contribute to our program. We have over 70 content experts from across our enterprise that are engaged in ensuring that our curriculum supports all of our sites. The healthcare systems and Florida sites just are not accredited. And so I just wanted to point that out, that Rochester does hold that accreditation for those 3 sites and practice settings. We do also enroll LPNs into our program, but LPNs are out of the scope of our accreditation as well. So while you still get great support and get the benefit of our curriculum, just that role is not within the scope of our accreditation. So let's take a moment to review kind of who is eligible for our program. So all newly licensed nurses with less than 12 months of experience are automatically enrolled into the program. There isn't a separate application. So when you apply to Mayo Clinic, Rochester, the healthcare systems, or Florida, your application to our organization is enough. There isn't a separate nurse residency like Part 2 application. Once you are hired, you are automatically enrolled into our program. We really believe that everyone will benefit from nurse residency, and so anyone who enters our doors as a new grad nurse gets to partake in our program. We have 7 cohorts per year, and so depending on when you start, you get put into a group of other nurses with the same or very similar start dates, so that you can go through that first year of practice together and really have that peer support that Cindy alluded to. That's so important. You all are walking that same path in that first year and learning and experiencing things together, which we find really beneficial. Our hiring timelines do alter a little bit based on site. So here in Rochester, we have start dates every 2 weeks throughout the year. In the healthcare system, Southwest Wisconsin, in specifically the La Crosse area, we cohort them 3 times per year. And then same for Florida, there's 3 residency postings a year. So if you're interested in those sites, just to have on your radar that there are specific posting and start dates for some of our healthcare systems or Florida sites. So if that is of interest to you, just have that kind of in the back of your mind of when you are preparing your application and resume, when to expect to be able to apply. Now I'd like to share more about the structure and the focus of our program. So our curriculum is designed to support you in your first year. We know that that time can be both challenging and transformative, and we understand that the first year of practice can be really difficult. And we want nurses to know that they're not alone in facing those challenges. Many others, a lot on this call, my fellow panelists today have been through that. And we want to support you. And our goal is to provide consistent support and guidance throughout your transition. Like I said, our program here is offered across Rochester, the healthcare systems in Florida. It's a 12-month program. So from your very first day of employment until that end of that first year, we do welcome a little over 1,000 nurses per year into our program. So around 700 of those last year were from Rochester. And we deliver our curriculum in a few different formats. So we use asynchronous learning, which is in an online platform. So it's like modules and videos and activities that you do when it works for you and your schedule, and that kind of varies by site. And this really allows you to complete pre-work before attending seminars, giving you a good foundation of the content before coming to class. And then we have 7 synchronous seminars, so live classes that are either in person or virtual. So our nurses in Rochester, La Crosse, Wisconsin, and Jacksonville, Florida attend in person in classrooms with their fellow residents in their cohort. And everyone else attends virtually. And we do this via Zoom. So we have one class that has all of our residents from all of our sites. And this approach really ensures that everyone is receiving the same content at the same time, no matter what your location is. It's really great for us to be able to tap into content experts throughout our enterprise. So I can hear from an expert in Florida in our Rochester classroom. These 7 seminars are based on our Mayo Clinic nursing professional practice model. And we'll show you that here on the next slide. Our Mayo Clinic nursing professional practice model is grounded in relationship-based caring. It recognizes that science and art of nursing, emphasizing both technical expertise and compassionate care. It extends nurses' roles beyond the bedside. You can see kind of a list of those roles, and that's what we base our seminars off of. So it really reflects our organizational commitment to clear communication, team well-being, and empowers nurses to have a voice in patient care. So you can see those roles are caring healer, pivotal communicator, teacher, navigator, vigilant guardian, problem solver, and transformational leaders. This model also ensures that nursing practice is not only patient-centered, but it's collaborative, it's evidence-based, and it's innovative. This is a graphic of that 12-month program designed to support you. So like I said, your journey really begins on day 1 at Department of Nursing orientation. And in that period of time that you are in your practice based orientation on your work unit, you'll be paired with a group of preceptors that help guide you and help teach you as you complete your initial competencies. So you can see that we have that in the graphic about the 3 months. It depends on your work area, of course. Some may have longer orientations, some short. It really is practice specific and individualized to your needs. Around the 3 to 4 month mark, you'll begin your nurse residency seminar series, which will continue throughout that first year. So you can kind of see those 7 seminars based on that Mayo Clinic nursing professional practice model roles. We also offered a structured mentorship program, so we can pair you with a mentor. Our mentorship program actually allows you to be paired with anyone from across the enterprise. So mentors are really excited to support you and meet your needs, and we are able to offer that to everyone, no matter what their location. And throughout that first year, you may have other classes and specialty training specific to your practice area. These include your practice-based curriculums tailored to your specialty. ensuring that really you are gaining the knowledge and skills to be successful and to take amazing care of our patients. This timeline reflects a comprehensive approach to help you transition confidently into your practice. We mentioned this earlier about our in-person site, so just a little visual of how we come together across the enterprise to really have a strong program where we can all learn together in a blended environment. We have a lot of activities, breakout rooms, even though some are virtual, some are in person, so it's a really engaging experience. And here is a list of our topics that you can expect throughout that first year. We really want to help you manage the learning process without feeling overwhelmed. We release the curriculum in sections over time. So over the course of that 12 months, we have a structured approach to make sure that you are getting the curriculum topics and the professional development to really build on that strong foundation to build both your clinical and your professional practice. And these are just some of the outcomes that we track and are committed to. So one way that we demonstrate this is through robust quality outcome measurements. We track many key outcomes, including professional development, learner competency. We do program surveys. We look at retention rates, stakeholder satisfaction, and these outcomes are monitored really closely for trends, and we benchmark both internally and externally to ensure that we're not only meeting the needs of our program, that we are on par or exceeding the outcomes from other organizations. This data really helps us to make program enhancements to make sure that we are aligned with those global standards of excellence. This continuous improvement approach really helps us to be innovative, make sure that our content is evidence-based and that we're responsive to the needs of our nurse residents and also of our organization. We have found that this really enhances high quality patient care and professional growth for you as a nurse. So now I will turn it over to Cindy to talk about our amazing program in Arizona.
Thanks, Catherine. So here are a couple pictures of our Southwest desert area. And so you can see our hospital on the left, kind of at sunset, and it's beautiful. And then one of our clinic buildings on the right. So we'll take just a little dive now into the specifics of our program in Arizona. So the Nurse Residency Program residency in Arizona was established in 2003. And it has maintained real steadfast commitment to evidence-based practice for new graduate nurses for over 2 decades. Similarly to Rochester, in July of 2018, Arizona became accredited with distinction by ANCC PTAP. And we were the first in the state of Arizona. So we were really excited about this growth and kind of just blazed the trails, and other hospitals in the metropolitan area kind of followed suit. Really, this whole recognition for PTAP, ANCC PTAP accreditation underscores our program's dedication to supporting new nurses in their transition to practice. So again, likewise to Rochester in 2025, we received our 3rd reaccreditation. And that's really, again, ongoing, reaffirming our commitment to excellence, just really to, as I said earlier, that gold standard and adhering to that in our residency education. I've been the program director since the inception of the program. I've had the privilege of presenting nationally in our annual conferences for ANCC PTAP about 4 times nationally. I've been an appraiser and just really rooted and grounded in understanding what is residency all about. So as you can see on our slide here, we have clinical areas in our Phoenix campus and then in Scottsdale, and all the different practice areas that we have designated for. Our program eligibility There are some similarities with what Catherine presented. It is for anybody coming who has less than 12 months of experience, would be eligible to be in the residency program. We have a little bit different in the sense that there is specific applications for residency positions. And so that is because of the cohorted model, which I'll talk about in just a minute. We hire 2 to probably 4 times a year, based on whatever the organizational needs are. So all of our residents start at the same time on the same day, and then kind of journey through residency. So we believe in Arizona, for the population that we have here and in the metropolitan area with other organizations, that cohort model really helps to set apart in building that support network, the peer support we were talking about earlier, because you're facing similar challenges and struggles, and celebrate together those milestones. We believe a cohorted model helps to allow for collective learning. We have nestled in there lots of different components of the program, which we'll speak to, but really just helps nurses develop a strong professional identity as you work together and process those challenges and milestones. So that cohorted piece allows you to just support one another and also be successful in this year-long journey. So the timeline, as I said, there'll be specific positions for residency in Arizona. So this is very different than the other sites. And for example, this year we had 4 cohorts for 2026, and you can see the job postings are several months prior. So for the July cohorts coming up will be in March. June posting for the positions will be for the October cohort. And then in the fall are the postings for those early winter cohorts. So our website is up to date with when those days are. Now, a little bit about our program quality outcomes, and Catherine talked a little bit about what theirs are. Very similar. Really, our quality metrics are essential for us evaluating the effectiveness and the impact of the residency program. Without it, we can't tell the story to our stakeholders and be able to show the value of what this program offers in graduate nurses. So those metrics really provide objective data that guides for process improvement, demonstrating to our stakeholders our value, and really helps to be sure that we are following our North Star, the goals and outcomes that we have discussed earlier. So demonstrating our effectiveness, those metrics as we trend, are really just looking at retention rates, our satisfaction scores, competency assessment, how are you feeling as a new nurse over time, and obtaining those things. We're trying to ensure that we have consistency and accountability. So standardized metrics help us to show that we have high quality care and it's evidence-based, and that we are confirming that the program maintains its excellence and standards. So we have the organization to answer to, as well as our accrediting body. There's some guiding program improvements that are important. So the regular measurement of those allows educators and leaders to identify our strengths and areas for improvement if we see that. So we're trending and tracking that data over time, and we make adaptations and change it for the betterment of the learners to make sure that we're really meeting the residents' needs. And then finally, enhancing professional development. By measuring the growth in clinical competence and in confidence, and we have tools that we measure through, really helps to know that we are having some really valid and reliable outcome measures that show that we are shaping the skills and the requirements needed for nurse residency to be very prepared for lifelong success. So here's a little picture of one of our groups. This is a fun activity we do. We have the structure, a little bit more of the residency in Arizona is we have a blended approach, similar to what Catherine had talked about earlier, for that whole year. The asynchronous is the online platform that we too use. So curriculum is shared across enterprise where applicable. So there's always pre-work that the resident will come prepared, and then either for an in-person session or a simulation thereafter, then they're applying those concepts. So it's often the pre-work that lays the foundation of the curriculum. And then there might be a virtual session or a workshop in person where we can go a little bit deeper into the understanding and really engage in activities with those. So we have in-person breakout sessions, or if it's a virtual session, we may have a virtual. We use Zoom for the platform if it is virtual. And then we have a lot of in-person sessions, and those are occurring, there's some in-person monthly. And then we have high fidelity simulation. And this is a big part of our residency program in Arizona, that we have an experiential learning center. And every couple months, there are about 12 high fidelity simulation scenarios through the year that residents go through. So this is really just an opportunity, again, to apply those concepts. So this blended model of the asynchronous, synchronous really offers flexibility and maintaining the benefits of meeting those program goals and equipping the residents for being successful in that first year. So this schematic shows a little bit about how we kind of break down and plan our curriculum throughout the year. There's 3 main blocks, and you can see that on the slide here, where we use the framework of going again from more unfamiliar and then working our way through to higher skills. So block 1 is the onboarding. So it's the first couple of months we're introducing the new graduate nurse or resident into our organization, setting those professional standards, foundation and clinical skills. In Arizona, we have 3 full-day skills. So programming the IV pump and working through how to suction a patient, place an NG tube, things like that. And just that practice in a safe environment in an experiential learning area before even working with a preceptor. Socialization, really important to get to know your team members and all of that. The second block is like that 3 to 7 month, and that's that clinical immersion and really diving into that skill development, the clinical experience and advanced skill acquisition. So now we're dealing a little bit more with layering that level of knowledge. So they're rotating through those simulation experiences. This is where a lot of specialty unit education is occurring. So if they're going to critical care or the emergency room department, what specialty education is required, and then some collaborative learning activities. And then block 3 is really focusing on that professional growth and transition to practice development. So we're looking at that professional identity. What are you going to think to do after that year mark? And kind of looking at evidence-based practice, doing a journal club, answering a PICO question, things like that, where we're piquing the spirit of inquiry and why we do what we do and challenging perhaps what we do. So really empowering and refining professional identity to ensure that you're feeling fully ready for your autonomous practice when you come off that first year as a new nurse. So these 3 blocks really help to guide in that orientation and immersion and produce that professional growth in the first year. This slide just had this bubble slide. I love it. Just as just a little bit of a hint in seeing what it is that the topics are that we cover in residency in the year-long program. This is not an all-inclusive list, but just some of the areas that we focus on. Wellness and transition support is huge, and that bubble is quite large here, and it is very important. Just checking in, learning from each other, having opportunities, because it's that peer support, as I said, that we've seen time and time again make a difference. But lots of skills and professional advancement, ethics, like lots of topics all throughout. And this aligns really, these topics align really closely with what is also required and what we need to showcase for our accreditation standards as well. So in addition to the Central Nurse Residency Program educational sessions, there are going to be specific education, as I said earlier, population, equipment for those practice areas. So that's really happening also on a unit level. So what we're talking about today is really the centralized residency program curriculum. So Mayo Clinic, we have what's called the orientation record, also known as the Tier Skilled Acquisition Model, TSAM, you'll hear used for short. And that's really tailoring the onboarding of the new resident in a work area, and all work areas are different as to how do I know if I'm achieving the goals for being a safe nurse on this unit? How much orientation time do I get? So it's a series of competencies that they're guided with a preceptor and checking that off. And all the practice areas are looking a little different in what that orientation record looks like. There's role specific, again, education and competencies, and then maybe even some specific certifications based on the standards and the examples, such as maybe on the hematology oncology unit, there might be chemo certification that would be part of the first year education. So that's just one example. This next graph kind of just really depicts the variety of individuals that provide support for the program. So there's a lot of support. There is the nursing education specialists that are coordinating the program. We may have some administrative assistants that help. We have nursing education coordinators. We have subject matter experts that come to present that the residents are hearing from the experts on various topics, perhaps such as ethics, things like that. We have clinical nurse specialists, nurse managers, supervisors. So you can see it is a wide variety of individuals that are supporting residents through this first year. So kind of thinking about what are the benefits of seeking an accredited nurse residency program? Well, hopefully we've piqued your interest, if nothing else, to make the case that this is so important to you. So you're shopping, and as you're thinking about graduating, they provide structured support, as we've kind of discussed today. They do kind of support or outline that gold standard that PTAP set forth in the mid, and like my 2016, 17. There's enhances communication. We can tell our worth by providing measurable outcomes, and organizations can see value in keeping these programs alive and well. And it really guides nurse residents through that lifelong practice and success. So with that, I'll hand it back over to Catherine.
Thank you, Cindy. So we are excited to help support you in your nursing career. And I hope that this was informative to you. And we do have a lot of people on this panel today to help answer your questions. I know some of you have been putting some questions in the chat, which is great. There's a Q&A. So hopefully if you've put a question in there, you can see your answers. But really, we hope that you choose Mayo Clinic for your career. We really are excited to welcome you into our organization and really choose a career here that will be lifelong for you. There are ways to stay connected to Mayo Clinic on social media. So you can see on this slide a few different ways to see and follow Mayo Clinic here. And so now we have a few minutes left here of our webinar. And so we would like to open it up to your questions. Like I said, I think a lot of them have been answered, but Heidi, was it best for me to just kind of read these? Is that okay?
If you see them, yeah, I'm going to stop sharing here just so that we can all see each other. There's still some in there that we can round table.
Yeah. So does a ICU preceptorship better your chances for an interview?
Yeah, well, maybe I should jump in on this one because
I'm not sure if I'm the best to answer that one.
Yeah, it depends, which is a non-answer. I understand that, but it really depends on what you're seeking out and what is available within the organization, which you're applying to. Any healthcare, direct healthcare related experience is beneficial. The more, the better, honestly. It's just giving you more time to prepare. And it really kind of is a precursor to the skills you have developed at this point in time when we're considering you for that next step to moving towards an interview. It's not the only thing. You don't have to have, direct, I should say you don't need direct clinical experiences in all areas. We do have some qualifications when it comes to areas of critical care, at least in Rochester Mayo Clinic. We look for more hours directly in an ICU of similar caliber to what you would experience here at Mayo Clinic before moving you towards that interview and to be considered for critical care. And if that's not something your program allows, we will consider you for other areas that will be beautiful building blocks to where you are at this point in your career and kind of help you work towards whatever it is your future goal is. Yeah.
Perfect.
Thank you.
Thank you.
Question. Mm-hmm.
Yeah. How far in advance from graduation is it recommended to apply? So I can start that out. Hopefully the presentation helped kind of answer for some of our sites. There are specific application periods. So if you know you are wanting to start in the summer because you graduate in May, be looking at those sites when their applications open for those summer cohort starts. For other sites within the enterprise that it's kind of an open, there isn't a defined application time frame. I guess, Heidi, what would your recommendation be?
My recommendation would be certainly in your final semester is when we typically will see applicants. If you want to be considered for an area and want to put your best self forward, I would say apply when you're ready, when you've had ample experiences to be prepared for that interview. The more experience you can get, the stronger your examples will be when it comes to that interview, which really is kind of your first selling point to how you will show up in our organization, why we want you to be part of Mayo Clinic. If you're preparing for a large capstone in an area that you're particularly interested in, I say wait. If you can draw examples from direct clinical experiences in the area you wish to be considered from, you're going to be stronger in that interview. So you may want to wait for that final capstone or clinical immersion experience, but I would say in your final semester is an appropriate time.
And I would add, for the state of Arizona, it takes quite a while to process applications. So as you're in your final semester, it's imperative that you go to the State Board of Nursing and do the application for examination by licensure so that you get that ball rolling early on, because you need to be fully licensed and flex all of that before you start. So you're doing that kind of in tandem with your schooling as well. So that applying to the state board and preparing for examination is important.
Thank you. Are you able to discuss with a coordinator your goals for the future to better find a suited department or role? For example, if my ultimate goal is nursing informatics, would you be able to get a role that aligns with that? I think when you put your application in, we have an amazing group that looks at your application, will connect with you. What are your goals? What would best fit you? Our goal is to, align with your needs and our needs, right? We want to make sure that we're setting you up for success. Like Heidi said, we're getting you really solid building blocks for a long, successful career. And so, yes, we have intentional conversations to make sure that you're placed in an area that's really going to make you be a successful nurse. How often do new nurse residency applications come out? I think we've answered that. Kind of depends on the site. There's specific times. So be looking on our website for those nurse residency applications, depending on which site was of interest to you. For the Rochester campus, if my application is not selected for ICU, may I reapply to another specialty, such as oncology? So for Rochester, there's a nurse residency application now. So you'll apply to our kind of program. You'll talk with our nursing placement about what your goals are. So if oncology is something that you are looking into, that's a specialty that piques interest to you, then when you talk to nursing placement, they'll be able to kind of let you know what units may be best suited for you in that specialty. Do we get hands-on in-person experience or trainings with preceptor nurses on the floor? Yes, you get lots. So during your orientation, that period differs from practice to practice, depending on your specialty area. But yes, you'll be paired with a preceptor or group of preceptors during your orientation period that will last over the course of several months. Like Cindy alluded to, we have that tiered skills acquisition model, which all of our enterprise follows that same orientation record. I'm really drawn to Mayo's team-based model of care. For a new graduate who hopes to grow into an ICU role long-term, how does the program help nurses build strong interdisciplinary relationships? I don't know, does anyone want to take this one? I feel like I'm doing a lot of talking. If anyone wants to jump in, that's just fine. I can continue. So I think that is really a huge benefit of nurse residency. So we actually have a wide variety of subject matter experts from other disciplines. So one of the standards that actually we meet in our PTAP accreditation is how do we help prepare you to be successful in those interdisciplinary roles? We know that it takes a huge team to care for our patients. And so one of the things that we help you with is communication, how to reach out, the best way to work in a team when you have a wide variety of roles taking care of a really complex patients. And so that is definitely one of the ways that we help build you up to be successful in nurse residency. Are international students who have completed their RN studies here in America eligible to apply? Yes, but I don't know the rules around it.
Yeah, I can jump into this one. What I typically say is read the job description in which you're applying. It will indicate if there is sponsorship available for individuals who are here on a student visa, what that will look like long term. So it should indicate in the job posting itself. If there's still confusion around that, certainly you can reach out to the placement office and we'll be happy to help on a case-by-case basis and make sure that we steer you in the right direction.
Thank you. I'm a sophomore pre-nursing student at Minnesota State University, Mankato. Congratulations to you. I'm interested in gaining clinical experience. When do summer student positions typically open, and are there roles available to students who have not completed their CNA certification?
Yeah, so this will look different depending on the site in which you're hoping to support. So definitely look at the job line. Typically for a summer position, we're going to be posting sometime in this spring period for summer only positions. So look at that point in time. It is not required that you have your CNA certification, at least here in our health system sites or Rochester, to be considered for those unlicensed care roles.
Thank you. To clarify for Florida specifically, there is no separate nurse residency program application. You just apply to the open position. You are automatically enrolled into the program.
That is correct. However, we do have postings that will say to the nurse residency program where we hire in the cohorts. But if you also apply for individual positions, you will also, once you're hired, you will also be automatically enrolled into the nurse residency program. So yes to that answer.
Perfect. Thank you, Kathy. For Arizona, are the practice areas the only areas new grads are hired in?
Those are the areas right now that we're accredited to be hired into, which are all our inpatient units, ED, ICU, and ambulatory. So it's majority of our practice, but the answer to that would be yes.
What are some pointers we can prepare for to be part of the Mayo Clinic Nurse Residency Program? I think being here today, you're already on the right path. I think just being engaged, being ready to learn. There is so many resources at Mayo Clinic, and we really help you guide and navigate those. I tell our nurse residents all the time, nurse residency, what you get out of it is what you're going to put into it. So when you come to class and you're engaged and you're excited about learning and you're really taking we kind of our goal right at the end of the day is to make you such a well-rounded professional and to support you in that first year to help make you successful. And so I think when you come ready to learn and ready to better yourself as a nurse and as a professional, you're already setting yourself up for success. Any of my colleagues have any other words of wisdom to share?
Well said.
Yes, I agree.
Okay. Does Mayo Clinic assist with transferring nursing licensure if you're from out of state?
So that is something that will be the responsibility of the individual. If they're doing an endorsement process, they will have to go through that state board of nursing and complete the application and pay that fee to be transferred.
Okay. During the new grad orientation, how long are nurses paired with a preceptor in the ICU, and how are complex therapies like CRRT approached to ensure both patient safety and new nurse confidence? So I think this depends a little bit site to site and practice to practice. I don't have a magic number in my head, but several months. And there are those practice setting specific curriculums that I alluded to before. So those complex therapies that are really specific to those really critical ICU patients. We have many different specialties of ICUs here in Rochester. So you get a really robust curriculum to prepare you to just be an ICU nurse, but then also for all of those really patient-specific, specialty-specific things. I don't like to use the word things, but all the things that you need to know to be safe and competent to take really great care of our patients. And the reason I don't give a number on orientation is someone might need 20 weeks, someone might need 14 weeks because they just came with a wealth of other experience. And so know that at the end of the day, our orientation is individualized. We have, an idea for a new grad nurse of, typically what it would take you, but know that we are going to train you as long as it takes to make sure that you're providing safe care to our patients. At the end of the day, we want you to be really great caregivers. People come here and they're really, really sick, and we train you very well to take care of them. If I've been denied from the nurse residency application, does applying to a specific job help, or wait for another residency application to open?
Yeah, I can speak for Rochester specifically that we encourage all new graduate nurses, those to be considered through the nurse residency program, to apply to that specific posting, current state. So if you were denied from the initial round, please do wait for other application windows to be shared moving forward before trying to reapply to a unit specific posting.
Thank you. I'm interested in critical care residency on the Mayo site for Jacksonville. It states that the critical care residency is 20 months. Can you please clarify? I don't know where it says that. It is 12 months. So we'll double check our website to see if there's like some erroneous data out there, but it would be 12 months.
Right. And I think they might be talking about the actual orientation period. All of our residency are 12 months. But again, we don't want to tie a time frame to orientation because it's individual. And remember, our nurse residency program runs simultaneously along with your clinical education. So while you're still in residency, you'll be there a year. Your clinical education would be ongoing, obviously, but you'll be with the preceptor. And again, the time that you're with the preceptor will vary based on your individual needs for orientation.
Thank you, Kathy. I wrote my NCLEX RN in August 2024 and worked in a long-term care facility for a year, but now I desire to acquire U.S. hospital-based experience. Do I qualify for the nurse residency program? So we do need to stay within the inclusion criteria of our accrediting body, which is new nurses with less than 12 months of experience. That includes international education. So that you would not be a part of nurse residency, but know that you would still receive a very robust orientation, practice setting curriculum, and all of those things, but would not be considered for nurse residency if you have more than 12 months of experience as a nurse, whether that's US based or international. Is the hiring process on a first come, first served basis? Can I take my time in applying when it opens in March?
Anyone else want to jump in?
I would say no, it's not first come, first serve. Yes, there may be specific timeframes in which the applications are open. So if you're applying to a site that has a specific application timeframe, make sure that get your application in during that timeframe. But your applications are looked at very intensely with what was your education, what kind of healthcare experiences do you have, whether that was in your clinical or maybe you worked as a CNA somewhere, or whatever that might be. And so, no, it's not just we have X amount of slots and the first people that apply get them. We want the best of the best working at our organization and taking care of our patients. And so we definitely, look at your applications, compare them, and to ensure that we know that you'll be a great addition to Mayo Clinic, and then also that you'll be successful when you're here. I know we have 1 minute left. We have two. Should I keep going? Okay.
Yeah,
Who do I
maybe ask
contact
for
regarding
questions? Yeah.
Okay. Who do I contact regarding more questions as I get closer to the graduation application time? So usually on the applications, there's a contact.
Yeah, truly the best resource or the most appropriate contact would be the placement office. And we can throw that in the chat for you as well, so that you have a point of contact as you have questions and you near kind of that application window.
Perfect. When does the Rochester residency application come out? So the application is typically out most of the time. We do pull it occasionally just to make sure that we are doing that really good look at all of our applicants to ensure that we are offering interviews and positions to meet your needs and to make sure that you'll be a great fit for us. And so there is a nurse residency specific application, but there's not really like a set time today. It will state on there like how long the application will be open for when it's posted. There'll be kind of like an end date on there, but I don't know any other specifics to that, Heidi.
I usually say check back on the Mayo Clinic careers webpage under nurse residency and training programs. That's where the most up-to-date information about application windows will be. And as soon as there's another one designated for Rochester, that will also be updated. So feel free to check that website as well.
Thank you. And how many slots are allocated for Arizona?
So this is based on organizational needs. What I can say is on average, typically our cohorts are around 40 or so per each hiring cycle. So that's just average.
Wonderful. Well, we are at the top of the hour. So I do want to just say a big thank you to our panelists. I told you this was going to be a full, wonderful information. We will leave a contact in a placement contact in our chat. Brittany, can you drop that placement at mayo.edu in there for me so that you have a point of contact? If you do have questions that were left unanswered, you're still curious, or confused by any of the responses, please do reach out. And I want to thank you all for attending and hope you have a great rest of your day.